Hello, my name is Salisa Westrick. I'd like to welcome you to Ep.3 of the education series on improving HPV-related cancers and diseases among pharmacists, where we will focus on identifying at-risk populations and overcoming barriers to HPV vaccinations. By the end of this session, you'll be able to identify which populations are at higher risk for HPV-related diseases and cancers, and have a better understanding of the common barriers to HPV vaccination and strategies to overcome some of these challenges within your pharmacy practice. People who are sexually active are at risk of contracting HPV. Most HPV infections do not cause any symptoms and eventually go away as the body's immune system naturally clears the virus. Some HPV-infected people develop visible genital warts or have precancerous changes in the cervix, vulva, anus, or penis. A small percentage of people infected with HPV develop persistent or chronic HPV infection. Women with persistent high-risk HPV infections are at greater risk for developing cervical cancer precursor lesions and cervical cancer. HPV-related diseases and cancers affect both men and women, but women are more impacted. As a result, the primary target for vaccination in most regions with limited resources is adolescent girls. Where resources and vaccines are available and feasible, the coverage is extended to boys, men, and women. The vaccination dosing and recipients' age also differ based on region availability or health authority. For example, the WHO recommends a 1-dose or 2-dose schedule for girls aged 9 to 14 years, a 1 or 2-dose schedule for girls and women aged 15 to 20 years, and then 2 doses with a 6-month interval for women older than 21 years. For more information on HPV and HPV-related diseases and cancers, you can watch the first episode of this series. Although new HPV infections are most commonly acquired in adolescence and young adulthood at any age, having a new sex partner is a risk factor for acquiring a new HPV infection. In addition, some people have specific behavioral or medical risk factors for HPV infection or disease, including men who have sex with men, members of the LGBTQ+ community, and people with immunocompromising conditions. So if patients have these risk factors at any age, a discussion with a healthcare provider is the best way to determine together how much a person may benefit from HPV vaccination to prevent new HPV infections. Again, most sexually active adults may have already been exposed to one or more HPV types, although not necessarily all the HPV types targeted by vaccination. As you recommend an HPV vaccine to adults, keep in mind that the HPV vaccine may still be beneficial as it will work to prevent infection with vaccine types to which a person is still susceptible. HPV vaccination rates are higher in high-income countries than low- and middle-income countries, where access and resources are limited, especially in parts of Asia and Africa. A recent study reported that only Bhutan, Brunei, and Singapore of the ANCCA have met the 90% first dose target. Additionally, many African nations are yet to include HPV vaccination in their national schedules, which further limits people's access to HPV vaccines. Having said that, even in some high-income countries, the coverage is not optimal. Disparities also exist within countries, particularly between rural and urban areas, due to factors such as limited access to healthcare, fewer providers, and lower awareness of HPV and the HPV vaccine in rural regions. Regarding sex disparities, a study in the United States found that women are more likely than men to start and finish the HPV vaccination series. Next, socioeconomic factors such as education and insurance play a significant role in HPV vaccination rates. Higher levels of education often correlate with better awareness of HPV risk and the benefit of vaccination, leading to higher vaccination rates. Similarly, individuals with insurance are more likely to have access to healthcare services, including vaccinations, while those without insurance may face financial barriers or lack access to vaccination programs, resulting in lower vaccination rates. People aged 30 to 34 years are less likely to initiate the HPV vaccine compared to those aged 18 to 29 years, possibly because by their 30s, many individuals may already have been exposed to HPV, reducing their perceived benefit of vaccination. Additionally, younger adults are more likely to be targeted by public health campaigns. Providers and routine vaccination programs make them more aware and likely to receive the vaccine. Also, married young adults might perceive themselves at lower risk for HPV due to being in a monogamous relationship, reducing their perceived needs for vaccination. We will start with barriers related to access and the environment. Start with patients-related barriers. High costs can prevent individuals from getting vaccinated, especially in areas where financial assistance or insurance coverage is limited, making it inaccessible for lower-income populations. Busy schedules or limited clinic hours can discourage people from prioritizing the vaccine, leading to missed dose and incomplete vaccination series. In areas without reliable transportation options, patients may find it difficult to reach vaccination sites, leading to missed opportunities for vaccination. Patients without seeing healthcare provider or clinic consistently may miss recommendations and reminders for vaccination. Regarding providers' barriers, healthcare facility may lack adequate space for counseling patients on HPV transmission and vaccination. Limited healthcare personnel can result in long waiting times or limited availability of vaccinations, making it harder for individuals to access the vaccine when needed. Turning to healthcare environmental factors, these factors can affect vaccination decisions. For example, rural areas often face shortage in vaccine availability and fewer healthcare providers, leading to disparities in vaccination rates between rural and urban populations. HPV vaccine supply shortage disrupt the continuity of vaccination services, making it difficult for individuals to complete the vaccine series. In countries without a national program, HPV vaccination may not be widely promoted or subsidized, leading to low uptake and inequities in access. It is challenging to identify and address gaps in vaccination coverage when there is an absence of national surveillance data on HPV vaccination. Lastly, maintaining the vaccine temperature is crucial for its efficacy. In areas without adequate cold storage, vaccines may become unusable, resulting in reduced access and coverage. The next group of barriers concerns information related to HPV vaccine and HPV infection. When people are unaware of the risk and consequences of HPV infection, they may not see the vaccine as necessary, which can decrease motivation to seek vaccination. Similarly, if they are unaware that the HPV vaccine is available and recommended, they may miss the opportunities to get vaccinated. Individuals who do not seek medical care may miss getting HPV vaccine recommendations from a healthcare provider. When strong recommendations from healthcare providers or public health campaigns are lacking, people may not view the vaccines as essential, leading to reduced uptake. Reminders play a critical role in ensuring timely vaccinations. Without systems in place to remind patients about upcoming or missed doses, people are more likely to delay or miss HPV vaccination. Regarding patients' misconceptions and fears, patients or parents who believe that the vaccine is unsafe or have dangerous side effects, such as affecting women's fertility, may avoid getting the vaccination for themselves or for their children. The fear of pain associated with the injection sites can discourage both children and adults from getting vaccination. Distrust in public health system or vaccination programs can also cause individuals to question the necessity, safety, and effectiveness of the HPV vaccine. Some individuals may not perceive the HPV vaccines as important, particularly if they believe they are not at risk for HPV-related diseases. Cultural and societal beliefs may influence parents to avoid vaccinating their children, especially if they believe that the vaccine will imply that the child is sexually active or that it encourages early sexual behaviors. Concern about the appropriate age for vaccination, such as thinking the vaccine is only necessary at a certain age too early or that it's too late to receive the vaccine, may cause delays in vaccination or missed opportunities for individuals who could benefit from the vaccine at different stages of life. The stigma surrounding sex and sexually transmitted infections, including HPV, can discourage individuals from seeking vaccination due to fear of judgment. This stigma can also prevent open discussions about the vaccine. There is a common misconception in some cultures that men cannot contract HPV, which reduces the intention to get the HPV vaccine among males. The beliefs in abstaining from sex until marriage may lead some to think that the vaccine is unnecessary, despite the potential benefit of early vaccination. In certain cultures, discussions about sexual health and vaccines like HPV vaccine may be considered taboo or sensitive and may require family approval before making health decisions. For married young adults, this cultural expectation can create a barrier to vaccination, as they may need to seek consent or discuss their intentions with their partner, which can delay or prevent initiation of the vaccine. This can be particularly challenging for individuals who face pressure to adhere to family or community expectations. Lastly, it is important to recognize provider-related barriers. Pharmacists may lack knowledge about the benefit of HPV vaccination in preventing HPV-related diseases and cancers, as well as the changing recommended age and dosing schedule. Further, another system barrier is related to the absence of prompts or reminders for providers to proactively assess vaccination status of the patients. This can result in ineffective or absent recommendations. Strong recommendations have been shown to significantly impact the likelihood of vaccination. If pharmacists perceive HPV vaccinations as a sensitive subject, they may avoid discussing it with patients, particularly in cultures where such discussions are considered taboo, thereby lowering the uptake. Next, without proper reimbursement for administering the HPV vaccine, pharmacists may be less motivated to offer it, especially in settings where financial barriers prevent them from providing the vaccine, leading to reduced vaccine access for patients. In cases where pharmacists view other providers as the health care providers responsible for vaccinations, they may hesitate to take an active role in recommending or administering the HPV vaccine, limiting opportunities for patients to receive the vaccine in pharmacy settings, especially in countries where pharmacists are authorized to do so. Lastly, pharmacists are often busy and therefore have limited time during patients' interactions, which can prevent them from discussing HPV vaccination or address questions about the vaccine. We recognize that some barriers, such as absence of a national HPV vaccination program or national surveillance data on HPV vaccination, may be beyond pharmacists' control. However, we believe pharmacists can play a critical role in addressing patients' fear and misconceptions about vaccines by staying informed about HPV and keeping up to date with HPV vaccine recommendations and dosing schedules from local health authorities. Pharmacists can ensure proper documentation of administered vaccines within their pharmacy and report them to local immunization registries where applicable. Additionally, they can use the ASPIRE framework to address patients' vaccine hesitancy. In situations where patients decline vaccination after discussions, pharmacists can encourage them to read more about HPV vaccine and request permission to revisit the topic in the future. Pharmacists should emphasize how this vaccine can help protect them or their children from HPV-related cancers in the long term. Further, pharmacists can establish a routine of checking patients' immunization status at every visit and be prepared to administer HPV vaccines when needed. In some countries, there could be some programs that cover the cost of HPV vaccines for those who are uninsured, underinsured, or those with limited income. But patients might not be aware, therefore, pharmacists can help inform them of these options. Pharmacists can install a systematic reminder in their system to flag patients when they're due for vaccinations. Additionally, they can collaborate with other healthcare providers to hold vaccination clinics or refer patients for their HPV vaccines. By working with local health authorities, pharmacists can help organize educational campaigns and vaccination clinics in schools and rural areas with limited healthcare access. We now learn that HPV is a very common virus, and pharmacists play a crucial role in improving HPV vaccination rates and preventing HPV-related diseases and cancers. It is important for pharmacists to recognize and adhere to the vaccine recommendations in their own country, as well as identifying populations at higher risk for contracting HPV. By understanding the barriers to vaccination, pharmacists can develop strategies to overcome these obstacles and make strong recommendations for HPV vaccines. In summary, pharmacists are essential in the fight against HPV, contributing significantly to public health by increasing vaccination rates and reduce the incidence of HPV-related conditions. Thank you for your attention and your commitment in the fight against HPV.